This is my final project about dreams. What are dreams? They are defined as products of consciousness during sleep in which a person confuses images and fantasies with reality or a series of thoughts, visions, or feelings. There are 4 stages of sleep. First one is non-REM 1, when you first fall asleep and you are still aware of the things around you. Then non-REM 2, where your heart rate and breathing regulate, your body temperature would lower, and then you become unaware of the things around you. Then there is the non-REM 3. Your heart rate and breathing fall, muscles are becoming relaxed, and you are not easily awakened. Then REM sleep. This is where your dreams occur. Your heart rate increases and blood pressure increases as well. Theories of dreams. Sigmund Freud, his theory was wish fulfillment, and his theory of dreams says that dreaming is wish fulfillment, thoughts, unconscious desires, or motivations. This did go against dreams that involve punishment or traumatic events, which led to people not believing in this theory. For example, parents don't allow their children to eat lots of sugar or junk food. Their ideas become unconscious and shown in dreams, with dreams about eating large amounts of candy and junk food against their parents' will. Then there is the Carl Jung theory. These are the dreams are direct mental expressions of someone's thinking and anticipate future. According to Jung, dreams are a way of communicating and acquainting yourself with your unconscious. Then there is the REM activation synthesis. This is where the brain makes sense of random stimulus, and dreams have no meaning. Advancements led to revisions of this theory later on. For example, when you have the most random dream and you wake up wondering what it meant, this theory says it has no meaning at all. Threat stimulation theory. Negative dreams are rehearsals for similar real events, and they help us to be safe and prepare. For example, when you have a dream about failing a test, getting hurt, running away, etc., you're preparing for that future event in this theory. What causes us to dream? The brainstem generates REM sleep and the forebrain generates dreams. Behind all the science, that is the easiest way to say it. So why do we dream? The Cleveland Clinic states dreaming helps you analyze, solidify, make sense of memories, and serve as a practice for situations in the future. So to make sense of it all, your brain doesn't stop thinking, so therefore while you're sleeping, it needs to continue to work. Psychological disorders and dreams. One of the psychological disorders is major depressive disorder. Depression isn't just sadness or feeling alone, it is accompanied by changes in the brain structure and chemistry. This is why people who are depressed will experience different dreams than someone who is not, because their brain structure and chemistry is much different than someone without major depressive disorder. This can include far more nightmares than the average person. The second psychological disorder that I researched was bipolar disorder. Dreams can occur far more frequently and can detect future moods that might occur. Dreams can be seen as more bizarre and vivid with death and injury. They experience more night terrors than nightmares usually. The third and final psychological disorder that I researched was schizophrenia. Dreams in schizophrenic patients are hostile, sad, threatening, and anxious. But some say that dreams are simpler and less elaborate, just depending on the patient and the patient's history, and of course the day. Looking over these 3 main psychological disorders, dreams are much more different than the general population, and nightmares occur much more frequent than the general population.